Good morning. We're at the Dentrix section of the Henry Schein booth here at PDC 2019. I'm talking with Ali Afzal. Ali is the operations manager at Century Crossing Dental Center in Alberta. So tell us a little bit more, if you would, about how important reports are to you and to the practice, and how much time do you spend on reports on a weekly and or monthly basis?
Sure, absolutely. Well, first of all, thank you for letting me talk about Dentrix. I love Dentrix because I use it really every day. For reports, as an operations manager, I really need to be able to make factual, data-driven decisions. So I generate specific reports daily. I generate specific reports monthly, just to be able to, again, see on a micro level the health of the clinic, and then monthly on a macro level how the clinic is being able to trend.
Now, we hear a lot of talk about having daily huddles. So can you tell me a little bit more about the daily huddle report and how that works in the practice?
Sure. So I use the daily huddle report in two aspects, two ways. One of the ways is with the staff themselves. So I don't like to kind of go into the nitty-gritty numbers with the staff. I like to more use certain trends, but use them as jumping off points with our daily huddle, just to discuss, certain, issues. For example, we're starting to see, more patients. Make sure we're addressing that, or, we're not seeing as many patients as we have in the past. Let's see why. Where I really utilize the daily huddle report is now making specific decisions or trends that I see that I discuss with my with the dentist owner now. How we did yesterday, how are we doing today, and any sort of kind of issues. And that daily huddle report is really important for me because that's where I'm referencing things from.
So speak to me a little bit, if you will, about how the whole integration of technology into your practice management software has affected the workflow in your treatment centers.
Oh, it's actually, especially with Dentrix, it's definitely been a big part of our workflow, and at least optimizing our workflow. So oftentimes what I do is I actually time and measure how long our appointments take. Now, if we're talking about an appointment that, let's say, for example, an hour-long appointment, if I can save 5 minutes from that appointment, over a day, I can fit in another appointment. And the reason why now I appreciate Dentrix in this is that there are a lot of different systems that can tie into it and make the workflow very easy. So rather than me opening up separate programs, loading up another patient, waiting for that to load, if everything is seamless within Dentrix, I already have the patient loaded. I can right away get to their x-rays, any intraoral pictures, any of their extraoral pictures, any of the other records. Within Dentrix, or at least a very easy jumping off point, then again, that saves me minutes. It makes everything smoother. In terms of patients, when I'm discussing and doing, not me, but when the staff is discussing doing treatment planning with patients, if they're able to show them a chart like this, and then right away, bam, show them their pictures, right? Show them their, we can right away bring them to other software, for example, our intraoral cameras. Great, that's a very smooth transition. For the patient, it looks good. For the workflow, it's very smooth, easy. It saves minutes, and for me, looking at the production numbers, that's important, right? Because I want to be able to fit as many appointments as possible.